As a cosmetic dermatologist, what I can tell you is a lot of people are not completely happy with their lips, but they don't know or understand which in-of-off lip procedure might be best for their goals. Is it a Botox lip flip? Is it lip filler? Do they actually need laser? So today I'm gonna break that all down for you. I'm gonna talk to you exactly the way I talk to my own patients during their consultation, so you can better understand what these treatments achieve and which one might be the best for you. Hi everyone, if you're new here, I'm Dr. Sam Ellis. I'm a board-certified dermatologist in Northern California, and the whole reason I created this channel was to give you really clear explanations about skincare and hair care and wellness so you can have the skin and hair of your dreams. It has been so fulfilling to help so many of you over the past few years. So if you like content that is educational and empowering, make sure you like this video and subscribe to the channel. I just want to start with a little disclaimer that whenever I talk about cosmetics, I never want anyone to feel like they must have these things done, or I'm pushing anyone to have cosmetic procedures. This is an incredibly personal choice. There is no judgment here. And what I have found practicing cosmetics is that the goal is to make people feel more confident. We do live in a society that rewards attractiveness. And particularly if you are a woman, you're going to be criticized if you age, and you're going to be criticized if you're vain. So it feels a little bit like a no-win. So just do what you want to do. I really wanted to make this video about lip procedures because the lips and the peroral area, so the area around the mouth, is an area that a lot of people have questions and concerns about. But sometimes during a consultation, patients don't have the right vocabulary to really describe what they are unhappy with, which is totally fine. It's my job as the dermatologist to kind of help us parse through that. But I wanted to give you guys more of a framework of what is possible when it comes to lip procedures and which procedures help you achieve what. So let's start with lip filler because I think it's the thing people are the most familiar with. Lip filler is essentially a gel. So it is a hyaluronic acid-based gel from various companies. If you're in the United States, you might have heard of Juvederm or Wutolin or RHA. These are all different brands of hyaluronic acid-based gels that get injected into all parts of the face, but can be used to enhance the volume of the lips. And within each brand, so for example, Juvederm or Wutolin, there are multiple types of filler that can be used and chosen for the lips based on how dense that gel is, how stretchy it is, how soft it is. So we're always going to pick the filler that's going to match your lip tissue the closest and is going to help you achieve your volume goals the best. So when you inject filler into the lips, it takes up space. That's why it can have a very plumping effect. So first and foremost, it can make your lips bigger, but it can also add just gentle hydration to the lips. Most of my patients, I would say, are not coming in saying, I want much bigger lips than I already have. Often what we are doing is trying to restore the lips. So we are trying to rehydrate them. They become raisins over your lifetime. We're trying to take them back into grape territory. And these hyaluronic acid-based fillers can be very helpful for that because hyaluronic acid is a molecule that draws water to it. So when you inject it into any tissue, and especially into the lips and the ones we choose for the lips, they can draw a little bit more water and add a nice plumping quality without looking overdone. So 1, lip filler can help with volume and fullness. 2, it can help with hydration, and a lot of people just want a little bit of hydration and restoration. 3rd, it can be really helpful with improving lip border definition because as we age, the transition between the pink part of our lip, called the vermilion lip, and the skin part of our lip, called the cutaneous lip, starts to get a bit blurry or wrinkled. And using small amounts of filler very carefully placed right at the lip border can really help give the lip back that definition without it leaning fish-like or ducky. Nobody wants to look like Marge Simpson. And sometimes we're trying to achieve all of those things with lip filler, and we're trying to ease or smooth out some of the lines within the lip as well. Now, I will caution you as a cosmetic dermatologist who gets this question a lot, patients will often say, well, I want all the wrinkles in my lips to be gone. And I can guarantee you, you don't actually want that. It will look so waxy, so fake, None of my patients come in asking for fake looking lips. They want them to look undetectable and completely natural. And the way you achieve that is not only with the product you choose and how much filler you put in, but also making sure that you're staying true to the natural lip architecture. Which brings me to my next point of what lip filler is not very good at doing. And it is not very good at changing the overall shape of your lip. Yes, we can add a little bit of height to the lips, we can add a little bit of fullness, we can enhance the natural architecture, but it's very rare unless someone's anatomy really lends itself well to this, where we can totally change the shape of someone's lips. And you've probably seen incredible before and afters on TikTok or Instagram. And what I will say is you need to take before and afters of lip filler with a huge grain of salt. A salt lick, perhaps. Before and afters with lips are really tricky because if you take them right after someone has their lips done, of course they're going to have swelling, which can make their lips look better. Sometimes that swelling makes their lips look worse. You also have to remember that people posting before and after photos are treating hundreds of patients every month or every year, and they are selecting the very, very best outcomes to share. And you also don't know if those photos are edited. The other thing lip filler is not great at doing is verting the lip. So a lot of times as we age, the philtrum, which is essentially the skin between the base of your nose and your upper lip, begins to elongate, and in turn the lip starts to curl in just a little bit. And a lot of people with lip filler are doing this. They're pushing on their lips and they're going, can you just flip my lips out a little bit? And to a very small degree, filler can help with that, but it's often not going to be to the degree that someone hopes or expects. Now, there is something that can help with lip aversion, which I will talk about in a second, but it is generally not lip filler. If you are having filler done, or maybe you're someone who injects filler and you're watching this for tips, which is totally cool as well. One of the biggest tips I have is not putting too much filler in a single session. The lips are a very confined space, and they can only hold so much volume, and then they need to stretch a little bit to accommodate that. And if you try to put a full syringe of filler in most people's lips, it's gonna start to take the path of least resistance, which is often out of the main lip compartment, and it starts to go above the lip or below the lip here, and that's when people start to look a little bit off. They have that lip filler mustache, or they have that dreaded migration. Doing it in smaller increments is not always going to feel the most cost effective because each session of lip filler can run someone anywhere from $700 to $1,500. But doing it in these smaller increments will absolutely make your filler look more natural. Often the approach I have with my patients is we start with a conservative amount of filler and then they come back 2 to 3 months later if we want to build off of that in a second session. And once we've spent a couple of sessions building them to their desired size and shape and fullness, then they don't require touching up very often at all. Maybe we check in at the 1 year mark or even the 1 or 2 year mark. But what I find is people mentally sort of adapt to their new lips. So after a few months, they think all their lip filler is gone. But if we look at before and after photos, the lip filler is very much still there, just as present as it was before. But the brain is interesting. It starts to see your new baseline and it starts to forget what you used to look like. And that's why it's also so important to have an injector that will say no to you. I say no to a lot of people when it comes to lip filler, or they're so excited to get more lip filler and they really don't need it yet. And it's so important to have this because otherwise that is when people start to look odd with their lip filler. They get what we call lip filler blindness, where one day they wake up and they say, oh my gosh, my lips look ridiculous. But for years, they've been walking around with something that looks really unnatural. And I know that was not their initial intention with having that product placed there. A lot of people also don't realize that lip filler is totally dissolvable. So in my cosmetic clinic, I actually end up dissolving a lot of lips. It's people who maybe have been treated elsewhere or maybe a long time ago, or they developed a little bit of that filler blindness and now they see the light and they realize that that filler is no longer suiting them. And it's something I often bring up in cosmetic consultations. Even if someone thinks their lips look great, I will tell you if they are not suiting you, and I will tell you, hey, I think we should get rid of some of this lip filler so that you can look more natural, because I think that's actually more in line with the goals that you have. And they certainly don't have to take me up on that offer, but I have restored so many lips over the years, and wow, it makes a huge difference. Now, aside from the lips themselves, another place people will often ask for me to place filler is in the vertical lip lines here. So as we age, particularly as women, we start to get these smoker's lines or barcode lines. Even if we are not a smoker or we don't drink through straws, you can be very genetically predisposed to it. But the key with this is if we are going to put filler into those lines, we have to use the very smallest amount, because what we don't want to do is add a lot of volume to the skin part of your upper lip. What I often say to my patients is, with enough filler, I can make any line or fold on your face completely disappear. But that should not be the goal. The goal should be that when we step back and look at your face as a whole, you look balanced and natural and rejuvenated. And if we just chase lines and folds, that's when you start to look done or look a little bit off or odd. I feel like there's been a lot of posts on social media demonizing filler and saying how it's horrible. And when not used correctly, any tool can be bad. But when used appropriately and strategically, lip filler can be very transformative and can really help people get that confidence back that they have lost. So I am never black or white with things. There is nuance to everything. Filler used inappropriately is problematic. Filler used well and strategically is going to be transformative. Another reason people will often ask for lip filler is to help improve lip symmetry. Often one side is a little bit lower or less plump than the other side. And certainly we can use filler to nudge someone towards symmetry, but only if that asymmetry is truly due to a volume discrepancy in each half of the lip. More often than not, I find that lip asymmetries are also due to how the muscles move, the underlying bone structure, sometimes even the teeth. And so, yes, we can continue to nudge your lips towards symmetry with filler, but understanding that there's going to be limitations based on the cause of your asymmetry. Now, moving on from lip filler, I want to talk about a lip flip, which is typically done with Botox, because this is something that a lot of people have questions about. Essentially, what a lip flip is it's us placing a very small amount of a neuron modulator. So a molecule like Botox. Other brands include Dysport, Jeuveau, Xeomin, Daxxify. These are all things that work to relax muscles under the skin. And we place a very small amount along the lip border. And what that does is it relaxes the muscle around the mouth and it allows the upper lip to vert or flip out just a little bit. For a lot of people, when they're at rest, they're quite happy with their lip volume, but when they smile, their upper lip curls in. It goes like this, and they lose a lot of that upper lip volume and they don't love what that looks like, and they feel a little bit cheated because they're like, hey, I have the volume, it's just not showing. Those are going to be the patients that are the best candidate for a Botox lip flip, because they don't need more volume, they just need the volume that they have to show when they animate. And although this change is going to be the most obvious when someone smiles, because you will see that their lip no longer curls all the way in and it stays sort of flipped out, and they keep that volume when someone is at rest, it also does make their upper lip look a bit bigger. So if I have a patient coming in and maybe they've been thinking about lip filler, but they're a little nervous to commit, or they just want the smallest bit more volume, we often will start with a Botox lip flip. This will give them a chance to see what their lip looks like with just a little bit more fullness. And oftentimes, especially in younger patients, they're like, that's good, that's actually all I really needed. It really is less of a commitment because Botox does not last a ton of time in this area. We use very conservative amounts, and when you're using smaller amounts of tox, it doesn't last as long. So 2 to 3 months is pretty typical, but it gives you a really good sense of what your lip would look like with just a little bit more volume. And for my patients, they are often not just getting a lip flip, they are also doing Botox in other aspects of their face, and they're maybe doing that every 3 to 6 months. And I am not topping up their lip flip in between. We don't want to be injecting someone with Botox every 2 months. That really increases your risk of becoming resistant to the tox, which nobody wants that. So I usually will have someone wait for their lip flip to wear off and then sort of wait for the rest of their Botox to wear off before we top anything up. Now, the biggest issues I see when it comes to a lip flip, and if someone's had a bad lip flip experience, it's usually due to being overtreated, because we cannot fully paralyze this muscle around your mouth. It's a very functional muscle. It helps you talk, it helps you eat, it helps you kiss, it helps you drink. So if you were to completely relax this upper lip, which would give you the best lip flip of all, it also would make your mouth non-functional. And I always talk to my patients about not wanting to make them orally incompetent. So we are always walking a really fine line between doing enough to get the desired aesthetic effect and the maximum duration possible, but not over-treating someone to the point where they either look ridiculous or can't function in their day-to-day life. It's pretty normal for the week that the Botox is kicking in for it to feel a little bit off or a little bit weird, but generally that sensation goes away, and you're still able to maintain the nice effects of a lip flip if it's done with the appropriate dose and placed in the right location. The last thing I'll say about a Botox lip flip is often people will ask for it if they have a gummy smile, which is when they smile, they see a lot of their gums above their upper teeth. And yes, that gum show can be from the lip curling in which case a lip flip is the right intervention, but often it's due to the fact that their lip is just retracting and lifting up really high. And in those cases, instead of placing Botox on the lip border, we'll place it at the base of the nose here, because then it will help drop their lip down. So when they smile, they're still able to lift their lip, but not as high as it was before. So their gums are not showing as much. It's also pretty common for people to have more than one of the things that I've already talked about. So we might do lip filler to enhance fullness, add a little bit of hydration, define the lip border, and then also do a lip flip, because when they smile, they still lose the volume of their lip. So we keep the lip eververted that way. So it's really important that when I'm having a consultation, the patient really understand what each aspect of their treatment is going to achieve and combining them when appropriate to get the best results. I do want to give a quick mention to lip lasers, because although we rarely laser directly over the pink part of your lips, a huge complaint that people tend to have is those vertical lip lines. And like I mentioned before, they are not perfectly reduced with filler. And in fact, you need to be so careful with putting filler in that area so that someone continues to look natural. And so often we lean on laser resurfacing technology to help reduce the lines around the lips. Now, the tricky thing about this is these are not gentle recover in one day kind of lasers. These are fully ablative lasers, meaning we are vaporizing columns of tissue around your mouth in order to get the tissue to contract and smooth over. So we're talking herbium YAG laser, a CO2 laser, something that's really going to aggressively resurface the skin. And often when someone is having this done, we are not just treating around their mouth, we are also treating their entire face. Granted, we are using different settings in different parts of the face, but they are looking at a solid 1 week to 2 week recovery. And just to give you realistic expectations, if you have deeply etched in lip lines, you can go through that entire ablative laser process and still have some lines on the other side of it. These are all treatments that help, but they do not perfect. Now, in my own clinical experience, I find that when I discuss these lasers and go over the risks and benefits, people get a little apprehensive, especially if they've not done a lot of cosmetic treatments before. So often what we will do is more gentle laser treatments like Frail, Halo, even microneedling, which is not a laser, to stimulate collagen in that area, but they're just not nearly as aggressive. And so you have to do multiple treatments to start to see the benefits, but they absolutely can contribute to smoothing out those lip lines. And again, like I said before, this is not often happening in a vacuum. People are having a little bit of laser resurfacing. They're getting small amounts of volume with lip filler. They're maybe relaxing the skin around the lips with Botox so that those lines don't continue to etch in, or they're getting a little bit of a lip flip. So we are layering treatments to get the best result. Now, the last thing I want to talk about is not something that's actually done generally in a dermatologist's office. It's done in a plastic surgeon's office, and that is a surgical lip lift. Like I mentioned in the beginning of the video, many women in particular, as we age, will have elongation of our philtrum, that distance between the base of our nose and our upper lip, and the lip will start to fall down forward and kind of curl inward. And when that happens, yes, we can do some restoration with filler. Tiny bit of Botox can help with that, but truly the best and most effective thing for fixing that is a surgical lip lift, where they actually remove a small strip of skin under the nose and physically pull your lip back up into place. There is no non-surgical intervention, laser, filler, Botox that can achieve that type of lift and rejuvenation. It is often part of a facelift. When someone has this part of their face lifted up, they will get a lip lift as well, because when this falls, this falls. But I am very clear with my patients when a lip lift would be the most helpful. And I'm never wanting to make someone feel like surgery is the only option, but I don't want them choosing the wrong thing because it's the easier or more affordable thing. I think ultimately for most patients, their goal is not to have dramatically different lips when they have any of these interventions. It's just to help enhance and balance what they're already working with. And the key with looking natural through all of this is to see a good injector, someone that has an artistic eye, that understands the safety aspects of all of these procedures, and who's really going to help deliver you the best result and be really honest with you if what you're asking for is not the right treatment for you. And if you have questions about how to find a good injector, I have an entire YouTube video on that. And I know this was sort of a high-level overview of everything. So if you want me to deep dive or answer any questions, please let me know in the comments. I'm always happy to make more videos for you guys. And of course, you guys know I respond to the comments as well. Hopefully, now you have a little bit of a better understanding about what these various lip interventions can offer you, and you can make the most informed choice to help you meet your goals. If you found this video helpful and you're excited to learn more about in-office treatments and what you can be doing at home, make sure you hit the like button and you're subscribed to the channel. It's been so amazing to watch this community grow. As always, thank you so much for being here, and I will catch you in the next video.